What is the chance I'll be cured if I take the treatment?
Now you've heard about the side effects of treatment, let me tell you about the chance it will work. The best predictor of this is the hepatitis C genotype or strain of hepatitis you have. Some strains are very responsive to treatment. For example, if you have genotype 2, then I would say you only need 6 months of therapy and you would have approximately 80 or 90% chance that the therapy will be successful. If on the other hand you have genotype 1, which is the most common genotype, then you would need 12 months of treatment and only have a 50% chance of getting rid of the infection. It's important to be clear about the chance of success before you embark on therapy to avoid disappointment. Discuss your genotype with your doctor. We now have some markers that we use during treatment to help us see how the treatment is going. At 4 weeks, if the virus is responding well, that's a very good sign that it's going to work. At 3 months, if the virus is still not responding, then it's very unlikely that it's going on for a year will be effective, and you may be advised to stop treatment then. If you're still positive at 6 months, it is certainly not worth continuing. Some respond to treatment while you are on it, but when treatment has finished, the infection comes back. This is very disappointing. You need to be mentally prepared for the possibility that the treatment will not work. I always say, hope for the best, but prepare for the worst. So how should you decide if you should have treatment? We used to do a liver biopsy so we could see if there was a lot of liver damage, and we only recommended treatment if there was. But many people don't want a liver biopsy, and we no longer require a liver biopsy for hepatitis C therapy funded by the government. There are other ways we can check whether you have significant liver damage. Your blood tests and physical examination, as well as an ultrasound, can identify patients with advanced liver disease. More recently, at some centres we use a FibroScan machine to estimate liver fibrosis. This is a pain-free test, a little like an ultrasound, which can detect severe fibrosis or scarring and cirrhosis, not obvious on a normal ultrasound or blood test. Remember, it is important to realise that even if you do not have any liver damage at the moment, no one can guarantee that you will not have liver damage in the future. Also, remember there are other ways you can protect your liver and your health. Keep a healthy weight, maintain good exercise and a healthy diet. Avoid drinking too much alcohol. 1 or 2 alcoholic drinks a couple of times a week, I think is okay. If you do this, your chance of liver injury should be less. You should also consider whether hepatitis C is your biggest problem. If you're a heavy smoker, it may be more important for you to consider stopping smoking than starting hepatitis C therapy, as lung disease and heart disease may be a bigger threat to your health. You don't have many symptoms of hepatitis C, and the results of your FibroScan and other tests show that your liver is in good health. You do have genotype 2. There's a very high chance that you will respond to treatment.
I've talked to my wife about the treatment. We've decided now was not the right time. Maybe in a few years' time, when the kids get a bit older, she gets back to work, and we'll be able to cope with it better.
If you decide not to undergo treatment now, you can review your decision at any time in the future. In the next few years, there will be newer and more effective therapies than the ones we have now for hepatitis C, hopefully by 2012. These drugs are in the research stage, and the early results are very promising. This is especially worth considering if you've very mild disease or a hard to treat strain of infection, or if you have had treatment before and it was unsuccessful. In summary, if you are interested in hepatitis C treatment, you need to think about the following: how likely it is to work, whether you are likely to tolerate it, what are your reasons for wanting treatment, and what will happen if you decide you don't want treatment. This information is intended to help you when you discuss the possibility of treatment with your specialist.